So how does the law impact you? Well, it depends on where you live. We're getting the lay of the land with our team of reporters in several key states. NBC's Mark Potter is in Miami, Florida. Charles Hadlock is in Georgetown, Texas. And our Leanne Gregg is in Denver, Colorado. Mark, I'd like to start with you. Mark is at a Miami medical center. Now, despite the fact that nearly 25% of Floridians are uninsured, that's the second highest percentage in the nation, Rick Scott has been one of the most obstructionist governors when it comes to implementing Obama. So what's the reaction there where you are to the new health care law?
Well, the sign-up is underway despite that. We're at the Brinken Medical Center in Miami, which services about 17,000 low-income patients a year. Two-thirds of them are uninsured. And so the response here is to set up this room where they're educating people, teaching them about insurance, and signing them up. There have been some computer glitches today. Not everything has worked, but the CEO here says he's very happy this day has come.
I've been in this business for over 40 years in the community health center, and today is the day. And this is the day of a new beginning, a new change in how we deliver health care or provide health care to those who are in need. And I'm very excited about it, and it's been way too long coming.
Now, an issue with the program here in Florida is that about 1 million extremely poor patients who had hoped for an extension of Medicaid so they could be covered will not be getting it because the state of Florida decided not to take $50 billion from the federal government to do that. So many of those people will likely remain uninsured. Let's now go to Charles Hadlock in Texas. Charlie?
Thanks, Mark. Well, Texas is one of a handful of states that does not have a health care exchange because of Republican opposition. So the federal government has stepped in to give money to groups like the Lone Star Circle of Care here in Georgetown, Texas, just outside Austin, to help people sign up in person. One of those people that came in today was Kimberly Heacock. She is a health care provider for seniors, and she does not have health care insurance herself, so she came here to shop. But they ran into a computer problem here because, well, there are just so many people trying to get through that the computer system crashed. Despite that, she is thankful that health care is now within reach.
I've always had this fear in the back of my head, I can't be in a car accident. I can't, I got to be careful when I go climbing in the mountains and things like that. I don't want to take any extra necessary risk.
They are having computer problems here, but they say that as time goes by, those will be worked out. Let's hope it's going a little bit smoother in Colorado. That's where Leanne Gregg is now. Hi, Leanne.
Hi, Charles. This is one of 8 community clinics operated by Denver Health, the largest provider of health care for the uninsured in Denver. Under the new law in Colorado, 2 key elements: expanded Medicaid and the state-operated exchange, where 18 different insurance companies will offer more than 500 different plans. The governor and the legislature supported the new law. This is where Barack Obama accepted the nomination for presidency back in 2008 under part of his platform to reform the nation's health care system. But more than 50% of the people in the state don't approve of the law. Many of those already have insurance, or they're seniors who don't think they will benefit. They're concerned about having to stand in lines. They're also concerned about quality of care. State insurance guides will help clarify what the system means for the 2/3 of the people in the state who really don't understand what it's all about. The goal, of course, to get everyone insured eventually. Mara, back to you.
All right, Leanne Gregg, Mark Potter, and Charles Hadlock, my thanks to you all.